Well, for us in Saint Lucia, Ministry of Health, the Substance Abuse Advisory Council Secretariat, in spite of our many years of progress in tobacco control, causes of many other diseases that we fight here in Saint Lucia, and these diseases are preventable. So the campaign, comes at the right time to ensure that we give information, we educate the public about the dangers of these new modes of using tobacco. Uh, and when we say the public, we think of everyone. The students, of course, one of our major targets. We think of not just the students, but the parents as well. We think of the teachers, the principals at schools, because we get a lot of, you know, cases from our schools with these devices. So these would be our targets in the campaign. And we really want to educate and empower, especially our young persons, to know that they have a voice in being ambassadors against tobacco. So they will be some of our loudest voices during this campaign. All right, for this specific campaign, because of what our research shows in our recent Global Youth Tobacco Survey, which surveyed all our secondary schools, 25 secondary schools in St. Lucia, from grades 8 to 10. So that will be our target audience, because that's the evidence that we got from them. We realized that the traditional way of using tobacco is on the decline in that age group. However, we saw a spike when it comes to electronic cigarettes, heated tobacco products. So the campaign comes on the heel of that research, the Global Youth Tobacco Survey, which we did in 2025. So that would be our primary target audience. But even during the survey, we realized that the students said that they are exposed to secondhand smoke. And a lot of that smoke comes from where they live, in their communities. So we realize that it's not just the students we need to speak to, but even the parents. The younger students, when we go out doing our teachings, would say that it's in a familiar place they get to use the vape for the first time. So realize that it's not just the students we speak to, but to their guardians, the parents. Some parents don't even know what a vape is or what it looks like. So they too need that information. So these would be our primary target audiences during this campaign. For us in St. Lucia, we are directed by what we call the Framework for Tobacco Control, which was established by the World Health Organization. And St. Lucia is a signatory to that framework. And we have made a lot of progress over the years. We know about the labeling standards. So somebody buying a packet of cigarettes will see now half of it has, one of those images that should be a deterrent to persons choosing to smoke. That was done in collaboration with SLBS. We also, from our end as the ministry, passed in 2020 these no smoking in public spaces. And, we really want to emphasize this with our population, because people are still saying that they experience persons smoking in large gatherings where persons, should be having a designated smoking area. So we really want to, again, emphasize the importance of sticking to that regulation, because there's no safe level of smoke, any type of smoke. So as long as persons in a public area are exposed to that, it can cause serious harm to them if they are not smokers. So based on, that public health amendment in 2020, we really want to continue to emphasize the importance of abiding by those regulations in bars, in restaurants, at public events. We really want everybody to enjoy themselves without smoking unwillingly. Well, for us, the plan really is to have or make a visual impact. So we'll be using social media again for the target audience, the young people, having content specific to their age group. Persons would see billboards as it pertains to the issues of COPD and smoking in public spaces. I assure you, some of them would grab your attention. And we urge persons, when you see these public service announcements being shared in your WhatsApp groups and on different platforms, that participate in the sharing, become an ambassador for the campaign. We really want to unmask the appeal of tobacco in Saint Lucia. We really want to show persons that it's not the colorful, advertisements, the nice flavors. That's the tobacco industry's tactic to get young persons hooked to the same old substance, tobacco. So we really want to expose the truth as it pertains to how harmful tobacco is. So persons will see it, you'll be driving, you'll see in the billboards in the south, the north of the island, you would see PSAs on your television. You'd see us presenting on various talk shows and radio stations, and we invite you to interact with us, give us your experiences, because we believe all of us has a voice as it pertains to unmasking the appeal of tobacco in Saint Lucia. Yeah, for our schools specifically, we have our peer-to-peer program being planned. As I was saying earlier, we want to bring students who are parts of certain groups like athletic clubs, parts of like the Red Cross, other groups in the schools, where the peer helpers, where they have experience in, teaching their peers. So they are somewhat ambassadors in their school. So we want to bring them and give them that information so that they can be our mouthpiece in their schools. We would use their talents in terms of developing posters, songs, jingles. And what we realize that young people are wanting that information from young people themselves. So for our school specifically, we'll be using their peers, the students' peers, to be the ones sharing that message. For the workplaces also, we'll be having a series of programs, teachings and education to ensure that persons understand the risks as it pertains to tobacco use and secondhand smoking, how it can affect them as well. We want to, as we said earlier, influence our parents through PTAs, the principals of the schools, through their meetings, providing the data for our GYTS, because the schools were one of our main stakeholders then. So giving back that information so they can know, the seriousness of what we're dealing with. And we want schools to, reach out to us, to have these presentations, to speak to the parents about, what a vape is, what it looks like, what to speak to your child about, so that we understand that prevention is just not about us here at SAACS, but all of us as a community can play a part in ensuring that the message gets out there. As it pertains to our social agencies, part of our campaign has a research base, it has a research component. So, and that research, we want to do it in a very, how should I say, graphic way, in terms of portraying to persons the amount of smoking that takes place in public. So we call it an ethnographic research, and for that we will be partnering with the different community councils, the persons who are responsible for cleaning up after those events, and we hope to be able to lay out all the buds of cigarettes that were collected, so you can have an idea as to, in that short space of time, how much smoking takes place. So the community councils, the workplaces, our schools, environmental clubs we have worked in the past will be important, because we know that when the waste from the cigarettes can enter into our, our seas, kill our wildlife and so on. So they too are important to this campaign. Well, yes, that is our belief, that the campaign will see a reduction of not just smoking, but to tell our general public about the dangers as it pertains to the new ways that the tobacco industry wants to hook our young persons. Sometimes we take it for granted that it's just the traditional cigarette, just the tobacco that we know in a cigarette form. But we realize how dangerous the move is to using these devices like the vapes and so on. And not just a decrease in smoking, but an increase in persons' knowledge as it pertains to what these devices are, what they contain, and how it can affect them. And for sure, it will be a plus, as Saint Lucia. We would want to boast that we have a smoke-free generation, and that really starts with you and me. That we play our parts in the persons we have influence on. That we can give them some information about the dangers of tobacco in all of its forms. Right. Our key message would be that, as I said earlier, in the prevention of a lot of the diseases that we see today, COPD being number one, affecting a lot of our young men, me myself being a young man. I I want us together to see that each of us can play a part. This is not just a Ministry of Health initiative, but we want our population to take hold of it. So when the message comes to you, it is shared to you. You get it through your WhatsApp or your Instagram. We want you to share it with somebody else. Share. You never know. You probably could save somebody's life by sharing the information that comes. If you know there's a group of persons in your community who would benefit uh, by a talk, or some teaching, contact us at the Substance Abuse Secretariat or through the Ministry of Health, and we'll be happy to provide that information. But again, we want persons to know that prevention starts with each of us coming together, playing our part. It's not just the ministry's thing, but we want the entire of St. Lucia to be on board to protect the future generation, our children, our nieces, our nephews, from the evils of the tobacco industry. That is really our key message for this campaign.